start off by just telling us what your name is and what you originally came in here for and how you were doing and how you're doing now.
Okay. My name is Christine, and I have been seeing Dr. Schiller about 10 months. I came last fall for a variety of reasons. It's not an exaggeration to say that I literally felt as though I was dying and that every part of my body was shutting down. I was recovering from Hodgkin's lymphoma, and I had guttate psoriasis over my entire body except my face. And I have tinnitus, and I was having 2 or 3 Meniere's attacks a month, sometimes as many as 2 a week, where I would have terrible episode of vestibular disorientation, fall over, throw up violently. And there were a couple of other things that
How about your thyroid?
Forgetting. At the time, I had been checked for thyroid disorder over and over, but my doctors, including my oncologist, couldn't reconcile my symptoms with their paperwork. The lab results, I was told repeatedly that my thyroid was normal, even though I had all the symptoms that I had researched on my own. When I came here, rather than let the paperwork guide the inquiry, Dr. Schiller turned that paradigm upside down and much more intuitively and scientifically looked at the symptoms and then did the supporting investigation with clinical approaches and connected those dots. And the result was that I have a very severe gluten allergy. I was producing antibodies to gluten, which were in effect attacking my own thyroid and undermining my adrenal system. And I believe that since most doctors only understand gluten as it pertains to celiac disease, of which I have none of those symptoms, it was ruled out over and over again.
They told you didn't have a problem with that?
I was told over and over again that I did not have a gluten, that this had nothing to do with diet. Mm-hmm. And despite the fact that all of my many symptoms or conditions are autoimmune related, I was also told that they were not related to one another and that it was just a fluke. So I feel excellent now. I don't have dizzy spells. I haven't had a Meniere's attack in 10 months. My psoriasis is completely gone, as you can see, which is the first time in 30 years.
How long did it take before you started seeing that result?
I started to see, my skin started to clear within 3 days of stopping gluten, and I remember it very specifically because it was just before Christmas. Mm-hmm. And my son, who lives in Europe, came home and hadn't seen me in 6 months or so, and he said, "Mom, you're back." Mm-hmm. This is after 3 days of my not having gluten products. And I was amazed. I sort of thought it was a fluke or the power of suggestion or what have you. But within 2 weeks of giving it up, my skin had cleared like 50%, and then now it's virtually gone.
And what about your the dizziness, the Meniere's attacks? You said those got better.
They stopped immediately, and I haven't had one in 10 months.
Have you been able to do other things now that you haven't been able to do before because of them?
Oh, absolutely. It was suggested by a neurologist that I give up my driver's license, which I really wasn't prepared to do, but I had attacks sometimes when driving. I'd have to pull over and throw up, and it was dangerous. I avoided climbing on ladders, walking down the stairs. I felt like a 90-year-old woman. I felt like my mother. Mm-hmm. And now I am playing touch football with my son, running around being productive as I used to be, certainly driving a car without any concern about balance issues. Stairs present no problem.
What they were before, stairs?
Yes, I had to take them very carefully and grip the banister for dear life. And often bright lights would bring on an attack, and that doesn't happen anymore. It's a very distant memory.
So what would you tell a person who was contemplating trying a program like that we offer. It doesn't have to be just for the condition you have, but for anybody that's considering this type of work?
I would say to keep your eye on the long-term effects or benefits. Be prepared to do some hard work, be prepared to give up perhaps some things that you love, but you will get your life back. You will get your health back, your mental peace of mind, your relationships. Everything you value will come back in force.
Well, that's awesome, actually. I'm happy for you. And I've been telling you that for a while. We've been trying to get this interview for a while. So I want to thank you for giving it to us, and I hope this encourages someone to do something about their own issues. So thanks a lot, Christine.
You're welcome.
All right.